Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm sitting here recording this podcast on January 1st, 2024. It's the first day of the year, a day where we all talk about our New Year's resolutions and we make goals about all the things that we want to change this year. And I've been thinking a lot about what I want to do. And my focus this year is this: I won't just let women live with their bladder symptoms. This is something that's really important to me. I talk to so many women every day who have been living with their symptoms for years, and there's lots of different reasons for this. There's some shame. Nobody really wants to talk about a leaky bladder. A lot of women have also been told that it's normal and it's just something that happens with age and you should live with it. And then sometimes the symptoms are minimized when they're brought up in a clinical setting, so-called medical gaslighting, where you bring up something that's really important to you, but it's minimized and you're told that it's normal. I would tell you that I want to change all of that. So your bladder is part of your body. It's part of the urinary tract. And just like any other body system, it ages and it gets some wear and tear. And while we're told that leaking urine is normal, it is common, but it isn't normal. Think about other systems in your body. Think about your heart and your vascular system. As we get older, high blood pressure becomes much more common. This is often a sign of bad habits like overeating or maybe not eating the right foods, smoking, and not exercising enough. There may be a genetic component, and age can make it worse as well. But no one says that this is normal, even though over a third of women aged 50 or older have high blood pressure. We treat it. We screen for it. No one is ever told that high blood pressure is just normal and you should live with it. What about your thyroid? It's common for your thyroid to stop working well as we age. About 10 to 20% of postmenopausal women will have an underactive thyroid. It's so common that we screen for this as well with a blood test. No one ever says this is normal. For some reason, we minimize bladder leaking and we think of it as just an annoyance. But it happens in about a quarter of women. It becomes more common as we age. And while women are told that leaking is normal, it really isn't. Lots of women are led to believe that leaking isn't important, but that also isn't true. When a woman leaks, she's likely to give up activities that she loves. She's less likely to be physically active. She's less likely to exercise, to trail run, to play pickup basketball with her kids or grandkids. Women who leak become less social over time. They're not interested in being embarrassed when they're out in public, and so they stop going out to eat, they stop going to movies, they stop going to see kids' baseball games, all because of the fear of leaking. I've even seen women who don't want to travel anymore or who find traveling really stressful. Dealing with a bad bladder on a plane can be really difficult. There's also a risk of sexual dysfunction and depression with leaking. So really important medical conditions. Leaking is strongly associated with a decreased quality of life. And if we want to age gracefully, we need to have good social relationships and we need to be physically active. And we should be very proactive about treating bladder leaking to encourage these things. So, as I said, my focus is to not let anyone live with their bladder symptoms. So let me just tell you about a couple of ways that I can help you. The first thing that I've done is if you just need an overview, you're just starting to think about your leaking and you're not really sure where to get started, then I would tell you that you should look at my Bladder Starter Series. So, my Bladder Starter Series is a series of free videos that walks you through the bladder and things that you can do. So, there's an intro, then I talk about diagnosing your leaking so you can figure out why you're leaking, because there are different types of leaking in women and we treat them in different ways. Then I talk about changes that help all leaking, the first steps to help stress incontinence, the first steps to help urgency incontinence, and then things that you can do while you're waiting for an appointment with a urogynecologist. This video series is something that I put together to help my local primary care physicians get their patients started. It gives you a lot of the background information as you're plugging into the system. And if you're interested in accessing this information, I would tell you to go to my website, thewomensbladder.com. And if you click on courses and memberships and then scroll down to about the middle of the page, you will see the Bladder Starter Series and it says free mini masterclass. And if you click on the learn more button, it will take you to the videos. Now, if you've kind of moved past that and you know why you're leaking and you're interested in strengthening your pelvic floor, but you're not sure what method would work the best for you, then I've created a masterclass for you that's called How to Find the Right Way to Strengthen Your Pelvic Floor. Now, there are a lot of different ways that you can do this. You can do it on your own with Kegel exercises. There are different products that you can use. There are different providers and coaching systems online. You can go to pelvic floor physical therapy, and I walk you through the pluses and minuses of each way to help you figure out the best way that you can strengthen your pelvic floor. Now, this is a course that I used to run with a live session, but now I've turned it into an evergreen, and it's in the same place on my website. So thewomensbladderdoctor.com under the courses, and it's called a masterclass for women. In this masterclass, I teach you how to create your own personal treatment blueprint where you define what's important to you. And this is really the key to a successful treatment. If you pick a treatment, but you don't have time for it, or it's not something that you really like, you're not going to be able to stick with it. There is a fee for this masterclass, so don't let that surprise you. But I will tell you that it is well worth it, and it is available for only $19.97. And then if you're at a point where you're really wanting to get started and you want the most in-depth course that I have to offer, I would tell you that that is my course, Bladder 101. And in this course, I teach about the anatomy, I teach about the vocabulary and how to be confident in your communication with your provider. I teach you about the different types of leaking and what may have caused it. I help you identify your bladder triggers and other health factors. Think things like hormones, medications, or other medical conditions that might be influencing your bladder's bad behavior. And then I go through to help you understand what products, providers, and coaches can help you strengthen your pelvic floor. At the end of this course, I want you to be familiar with all of the treatments out there and know how to confidently pick a treatment that'll work for you and fit your lifestyle. So if you're past the point of needing an overview and really want some in-depth information, then I would tell you my course, Bladder 101, is perfect for you. So if you're interested in getting this information, you would go to my website, thewomensbladderdoctor.com, and you would click on the membership and courses. And Bladder 101 is actually the first course that is listed, and it is my most comprehensive offering. So if you click on the Learn More button, it'll give you some more information. And then after that information, you'll see a Join Now button, and that's where you can click. So I have to tell you, every time I go through this information, I'm really proud of the information that's contained in this course. And I know how much it has helped women in the past. So if you feel like you need this, you should definitely check it out and come and join all of the women who have started improving their bladder symptoms. So, back to my goal for this year, I won't just let women live with their bladder symptoms. This is going to be my mantra, and I'm going to do everything that I can to help increase this dialogue, to get people talking about it, and to help you realize that there are things that you can do to improve your bladder and to help you age gracefully. Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.